All right, so the recording has been started. I'm going to introduce Ingrid Teamer, who is our account manager with Blue Cross Blue Shield. Blue Cross Blue Shield, of course, is the one that administers our medical benefit. So I'm going to pass the mic over and let Ingrid go from there.
Okay, thank you, Clark. And good afternoon, everyone. I hope everyone is having a great Friday. As Clark said, this is a meeting for you. So as I go along through the slides, please just ask questions through the chat, or and I'll be happy to answer them. I'm sure others might be having the same questions. So what I'm going to do today is
I think you went on mute there, Ingrid.
Okay, moving the slides, and I muted myself. All right. So today I'm going to go over your two options for your medical plan, which is the Select Care and the Total Choice. I will also review other offerings through your plan from Blue Cross and Blue Shield of Vermont, and definitely with time for any questions that you might have at the end also. So here is just a very simple overview of the both plans. Something to know about both plans is that the preventive mental health and substance use disorder benefits, there is no charge, okay? And we'll go over the preventive benefit in a few slides. Your primary care provider, physical therapy, occupational therapy, speech therapy, and chiropractor is a $25 copay. For the Select plan, specialist is a $30 copay. And then we also have copays for inpatient, urgent care, emergency room. There's no charge for testing. And there is a copay for imaging and no charge for durable medical equipment. This is all under the Select Care at the in-network level. And then for Total Choice, the benefit is just a deductible. So it's an individual deductible of $300, and then you have a 20% coinsurance after you meet the deductible, up to a $750 individual out-of-pocket maximum. And the next slide, we will see the plans. 1 second. And for some reason, I can't move my okay, there we go. All right, so the differences between the two plan options. The Select Care has two levels of benefits. You have your preferred and non-preferred. Preferred means when you see a Blue Cross and Blue Shield provider. So those are the providers that are contracted with Blue Cross. Non-preferred are providers that do not have a contract with Blue Cross. When you see a provider that is in-network, under the Select Care, there's no deductible. And as you saw in the previous slide, you have copays, okay? And then you also have an option to see out-of-network providers, and there is a deductible and coinsurance, okay? That is the Select Care. Under the Total Choice, you have one level of benefits, meaning that both preferred and non-preferred providers, you can see either one, and they will all apply towards the deductible and coinsurance for all services. And one thing to keep in mind is that if you see a out-of-network provider, so a non-preferred provider, you can be balance bill because the provider does not have a contract with Blue Cross. So you can be balance bill between what the provider charges, what Blue Cross allows, and the provider can bill you for the difference, okay? Then the good news is that our network of providers, the Blue Cross and Blue Shield, Blue Cross and Blue Shield national network of providers is so vast that most providers, 97% of providers are in network. And here in Vermont, it's even higher than that. Okay? And just to review medical terminology, copay means a fixed amount that you pay for a covered services. For example, an office visit or in an emergency room. So you pay that copay, and then everything else is covered by your insurance. The deductible is an amount that you pay for services before the insurance plan starts to pay. So the provider will bill, Blue Cross will apply that to your deductible based on the allowed amount, if you see an in-network provider, and then you have to pay for that deductible until you meet it. And then there's another term, the coinsurance, which is a percentage also that you have to pay after the deductible until you meet that out-of-pocket maximum. So the coinsurance, for example, can be 20%. The Blue Cross pays 80%. You pay 20% up to the out-of-pocket maximum. Once you meet that out-of-pocket maximum for the year, the services are covered at 100% by the plan. Okay, something that is really important is the preventive care. And preventive care is covered at 100%. So these are your annual visits, your primary care provider for all of your family members. This includes babies with their well baby checkups and well child checkups, immunizations. For women, the annual GYN exam, Pap test. For men, the PSA, mammograms, colorectal screenings, and lab and x-rays performed as part of the preventive. So there's a diagnosis that would go towards a diagnostic. So if you have a condition that you go see your provider, that wouldn't be considered preventive. Preventive is that annual preventive visit, and the provider needs to bill it as such. Okay, I encourage everyone to use this benefit. It's covered at 100%. We're so busy taking our cars for oil changers, mow our lawn. We do all these things for, maintaining our house. So we need to also just once a year go to our doctors to use our preventive services for ourselves. Okay. And just a reminder, there are some services that require prior approval. And these are services, just examples, CT scans, MRIs, scans, skilled nursing care. You will see a list of all of these services in your outline of coverage that you receive from Blue Cross. And you also have a summary plan description from the state that you can access through your website. And just remember that even though the provider is the one who submits the paperwork for the prior approval, you are responsible to make sure it happens. The provider, usually they're very good at making sure they have a prior approval so that they know that the service will be paid. But it's always good to check with Blue Cross. You can just call customer service just to make sure that the prior approval has been set in the system for the procedure that you're having. Okay. And a reminder, now with COVID more and more, 2020 changed the way we access healthcare. And so a lot of our providers have they're doing telemedicine services. So meaning that you can do a visit with your provider, whether it's a primary care provider or a mental health provider, through a Zoom meeting through video. So those services are covered. And in addition to that, you also have services through a vendor partner named Amwell. And again, you can have a video chat. This is more for urgent calls that you want to see a doctor quickly, and within, an hour, 2 hours, you just go into your phone, you need to set up, download an app and set up with all of your information, and then you can see a provider for any urgent or emergent care. There is also access to mental health services, and you can see a provider on a regular basis through Amwell through this app. Make sure that you just read a little bit more about Amwell, get the app and all of the information, so you can have that already in your phone. And all of that information is in our website, and you can just search under Amwell, and you'll have the step-by-step on how to download the app and what to do to access services. Just a reminder about offerings from Blue Cross, Better Beginnings for expecting parents. We also have nurse case managers who will help you coordinate care, help you with complex situations that you or your family member might need assistance with in navigating the healthcare system while you're dealing with a complicated condition. Also, we have chronic condition management and rare condition case management. If you receive a phone call, call us back, and you might get information. You might think that you know everything there is to know about your condition, but it's great to have that service and that nurse that can provide assistance to you or to a family member. And here we have our website address. We just changed our website address, even though if you still use the old bcbsvt.com, it will take you to our new website, new and improved. And our website address is bluecrossvt.org. And we also have a member resource center where you can access your claims, see the utilization of all your benefits, also see how a claim was paid, and you can also send secure messages to our customer service from your member portal. Again, here's the number, the customer service number to call. This number is on the back of your ID card. You can also email us. And as a reminder, also with our website. Okay, so let me see. Did I stop sharing?
You did stop sharing. Thank you.
Okay, great. Wonderful. So let's see, do you have any questions?
So there have been a couple questions coming up in the chat. I was able to answer them, I believe anyway. If I didn't answer them fully, feel free to ask again. But please, if you do have some questions, go ahead and throw them in the chat, or you can unmute yourself to ask them in person. Lisa, or there looks like a question did come in going about the cost of each. If you're referring to the premium rates, which is how much would come out of your paychecks, that the information is on the benefit website. You can go to that site to look at what the rates will be in 2022, or I'm sorry, the open enrollment site, and that will list out the rates. There's a question to go back to slide 3, which might have been the plan comparison. I think that was the side-by-side between Select Care and Total Choice. But you can confirm that when you bring it up.
Okay, hold on one second. I don't use Teams, so I am doing my best. Okay, here we go. All right, can you see it now?
Yes. Oh, no, I was wrong in the guess. But she's asking for slide 3.
Slide 3?
Yes.
Okay. All right. What is the question?
I think the question is they just wanted to see it. So I think we can just leave it up for a minute, and if there's a question on it, that can also come through. I do have another question here. Is telemedicine billed the same as a regular appointment? Meaning that would you still pay the same copay if you went to a telemedicine appointment?
Yeah, so the telemedicine appointment is a PCP appointment copay, and something that if it's COVID related, it is zero cost. But if it's not COVID related, then it is your regular office visit appointment cost.
Great, thank you for confirming that. There's another question about total choice, and I believe this is about balance billing. There's the maximum out of pocket, which they understand. They're asking about the balance billing that a provider could charge. Is this, could you maybe explain that a little bit more and explain if that applies to, or does this apply to the out-of-pocket maximum, or does this go beyond the out-of-pocket maximum?
Yeah, it is beyond the out-of-pocket maximum. So when a provider is a contracted Blue Cross provider, in their contract, they need to accept our allowed amount. So the amount that we pay for a specific service based on the diagnosis and based on the service. For non-contracted providers, they don't have a contract with us, so they can balance bill you. They will receive our allowed amount based on the service and how they're billing for seeing you for a specific condition. However, if let's say they charge $500, we reimburse $400, they could potentially bill you for the difference, which is $100. So, that's something to keep in mind when you see an out-of-network provider. And the other, when you see an out-of-network provider, many times they won't bill insurance, and so you might have to pay the provider, and then you would have to fill out a claims reimbursement form, and we would reimburse you based on the allowed amount.
All right.
Did that address the question?
I believe so, yes. Yes.
Okay,
but they
great.
can chime in. They can chime in if they feel that did not answer the question. I do have a question regarding the vision benefit. Is the one? I know we have the $100 that's every other year, or that
Right.
is every 2 years. Is the $100 going to cover both the exam and things like glasses or contacts, or is the exam covered separately?
So it's all part of the vision benefit. So the $100 allowance every other year or every 2 years is for that the vision, which is usually the exam if they do refraction, and so that's the benefit. In terms of materials, I don't think you would even, based on the amount, the $100, I think that would be just a visit. I don't think it would cover materials. And Clark, you can correct me. I always think about your benefit with the, the vision benefit with the state. It's more for the vision exam itself, and not for materials.
I believe that is correct.
Okay.
And to sort of to keep going with the vision, apparently we hit on something here. What if you wear contacts and need a vision exam every year? Because of that, will yearly visits be covered in that case?
So the state of Vermont benefit is for every other year.
Right.
And so I have contact lenses, and you're right. You need a prescription every year to get contacts, but the benefit with the state is $100 for every other year. Right. So there's no exception for those that wear contact lenses.
And there's a couple other questions, but I'll get to those because another vision one came in, so I figured we might as well stay on the topic. Do you
Sure,
have
of
to
course.
do you have to submit a claim for the $100, or does it get automatically billed and we get charged the difference?
So it all depends how the provider it wants to bill. If you go to a Blue Cross and Blue Shield provider, they will bill us. But if you go to a non-preferred provider, so an out-of-network provider, then you'll have to pay, and then you can submit for reimbursement for that $100 allowance.
Thank you. For preferred versus non-preferred providers, what if the provider is a Blue Cross Blue Shield provider but not in Vermont? For example, visiting family in another part of the country.
Yeah, so that is considered an in-network provider, just as long as they are participating with their local Blue Cross and Blue Shield network. It is all one big family, so each plan is independent based on the state. However, we all talk to each other, and we're all part of that one large network of providers.
Excellent. That's all the questions so far in chat, I believe. If I missed one, then please feel free to chime in. But otherwise, again, if you have a question that is not in the chat and want to ask in person, feel free to unmute and ask.
Good question.
Yes, go ahead.
I was just wondering quickly, does the preventative services, is that 100% covered in both plans?
Yes, that is correct.
Great,
Both
thank you.
the Select Care and Total Choice preventive is covered at 100%.
Thank you. And I see that Tristan has your hand up, so please feel free to unmute and ask your question.
Yes, my question was for when you are signing up for the plan and you have the family plan, like for you and your family, and then you have one for single and then the other one for two single people. Can you use, as a single parent, can you use the other single person as your child for one child?
Right. So the way to think about it is single coverage, two-person coverage, and family coverage. So
Yeah,
yes,
the
if
two-person.
it's correct. So if it's a parent and a child, you can do the two-person coverage.
Okay, perfect. I just wanted to make sure. Thank you.
Sure. All right. I'm not seeing any other questions in the chat. No one is raising their hand. Oh, well, we did have one. There you go. One did pop in. So for Select Care, what is the max out of pocket? I believe that was on that slide, but let's go over it again.
Hold on 1 second. Let me open it up.
Okay. I believe off the top of my head, I believe it's $750, but we'll figure that out when it comes up. I might just be totally making that up.
And you know, yeah, and you know what? I do not have the out-of-pocket maximum on the presentation, but I'm just going to go quickly to your benefits. It's just going to take me 1 second.
Okay.
I wish I could remember everyone's benefits like that, but okay, let's see. And we were talking about Select Care, right?
Correct, yes.
Okay, let me open that. It's thinking about it. I don't know why my computer.
Oh, I'm sorry. It's not. I'm thinking of. You know what? I'm thinking of pharmaceutical. I believe the max out of pocket is $2,000 for the year.
Yeah. So the out of pocket limit is $1,500 for individual and $3,000 for family. And just remember for the Select Care, things. A lot of things or services are copays, So they're very low amounts of out-of-pocket, so 25, 30. And then, for example, your diagnostic testing, there's no charge. So even though you have an out-of-pocket maximum, a lot of the services are covered under a small copay or no charge.
Right. All right. No hands, no chat. Every time I say that, one pops in. Oh, see, there you go. One just popped in. Can you show the chart of these costs with us? Has it been an update to the plan comparison chart? Last update was 2019. So the charts that you're seeing for 2019, they have not changed. That was the last time that we made any actual changes to the plan design or anything along those comparison charts. Those really should be labeled to 2022. Thank you. I will do so. But that chart is still the same today. We have not made any changes to the comparison chart, so you can still use that same one. We just need to change the date to say 2022 instead of 2019. So for travel outside the U.S., is medical covered?
Yeah, absolutely. So if you have strep throat, if it's something not as urgent, and I will get to that. So a cold, strep throat, or, you sprained your ankle, you pay out of pocket. You bring your receipts, and then you submit an out-of-country reimbursement form, and you get reimbursed for your expenses. If you're out of the country, and let's say you're sick, and this is an example of one of my clients, you get sick, you go to a hospital, they diagnose you, for example, with a brain tumor. What the hospital will do is contact, you show them your ID card, they will contact our plan, and we have an international section. All of the Blue Cross plans have this Blue Cross International, and they will work with the hospital around, wherever you are. Let's say you're in Nigeria, and for either you to have the surgery there or to the closest hospital where you can be treated if you can come back to the United States. Let's say that it's a condition that you must be treated in the U.S. because you are in a small place in South America. So we will fly you to the closest hospital that can treat that urgent or emergent condition here in the United States. And of course, we have nurse case managers that work with, ambulance for transport, air transport, to get you out of, whatever country you are, to get you back to the U.S. So I've dealt with many complicated cases in the past where our members get into very unexpected situations, when they're traveling outside of the U.S. And we take care of making sure that we have some hospitals outside of the United States will require a deposit, so we'll do a wire transfer of, like, for example, $40,000, so you can have your urgent surgery. And we are open 24/7 when our international phone line for any type of, of inquiry when you're traveling.
Excellent, thank you. We have reached the 12:30 mark, so I'm going to call it here. Thank you very much for everyone that attended, and thank you for the questions. If you do still have questions, feel free to reach out to me or a member of the benefits team. And if we, again, like usual, if we can't answer it, we won't pass it along to get an answer for you. So thank you, Ingrid, as well, for coming with us today and explaining the benefit. And I hope everyone has a great day and a great weekend.
Thank you. Thank you, everyone. Bye-bye.